So when I was 14 years old, I was diagnosed with something called juvenile rheumatoid arthritis, which is an autoimmune disease that um, creates a lot of symptoms that Crohn's patients also deal with. Um, for most of my life, I would say that my Crohn's symptoms were much more pronounced than my RA symptoms. But as I got older and older, those symptoms, such as abdominal pain and cramping, and a lot of changes in stool, a lot of blood in my stool, those sorts of things, they just sort of kept getting worse. And by the time I was a sophomore in college, I could hardly eat anything, and I'd lost about 60 pounds. So, I'm 5'5", and I guess it would have been a December of 2 years ago, I found myself at hardly 100 pounds and kind of realized that there was probably something else going on because I'd been vomiting every day. I could hardly eat anything, those sorts of things, and the blood in my stool was very concerning. So um, I saw a gastroenterologist and we did further testing. The first thing we did was an endoscopy and a colonoscopy. The colonoscopy came back with some inflammatory processes right at the end of my small intestine. And through my endoscopy, they found some ulcers in my small intestine. So those were kind of our first indicators for me to be diagnosed. But I was just really recently formally diagnosed. And before that, we were doing a lot to treat my RA. And what we've now decided is to treat both of these things with some of the drugs that are out there that can treat them both dually. So right now, I'm on a medication called methotrexate, which I inject once weekly by myself. And the other medication I'm on specifically for the Crohn's is Remicade. And that's an infusion, which I actually just had yesterday. And both of them have been working well for me. I know that a lot of patients struggle with infusions or injections, and maybe which one is right for you. And I think there's a lot of lifestyle factors that go into that you kind of have to evaluate. Another thing for me was that I really didn't want to do an infused drug for a long time because I had a lot of trouble with them being able to insert IVs in my veins and those sorts of things. So I recently had a portacath placed up here in my chest, which you can actually faintly see the scar there. And that's made my infusions and my lab draws and all of that, even my surgeries, so much easier. The other big thing that ended up happening for treatment in my Crohn's was that I had my colon removed about a year and a half ago. So those things, they were not easy options. They're still not easy options, and I'm make these decisions every single day. But I'm doing much better, and my symptoms are much more controlled since removing my colon, which was pretty much completely diseased and incredibly inflamed. So I still have quite a bit of uncontrolled inflammation in my small intestine, but we are starting to wonder if that's more related to some dysmotility issues and those sorts of things. So again, it's very complex, and no one's story is quite like another's. So um, it's important, I think, to recognize that and to keep that in mind as you go through your journey and make your treatment decisions. And especially important to really sit down with a doctor and have a doctor on your team or a nurse on your team who is going to kind of be able to help you bounce off, kind of bounce back and forth with some of those ideas, because it's hard to make decisions, especially big decisions that involve removing an organ. So I think I think that would be something important for all of us, and I'm still learning how to do that every day. So